Welcome to Wildlife Rehabilitation from Rescue to Release, a podcast dedicated to licensed wildlife rehabilitators and the veterinarians who support them. I'm your host, Gail Buell. North America is currently experiencing an outbreak of highly pathogenic avian influenza in both wild and domestic birds. To discuss this devastating disease and the implications for wildlife rehabilitation, I am joined by Dr. Victoria Hall, Executive Director at the Raptor Center at the University of Minnesota. Dr. Hall is the Patrick T. Reddick Endowed Chair in Raptor and Ecosystem Health. She holds a Master of Science in Preventive Medicine and a Doctorate of Veterinary Medicine from Mississippi State and is board certified in veterinary preventive medicine. Dr. Hall has spent her career working at the intersection of human, animal, and environmental health, an intersection known as One Health. Dr. Hall formerly served as an Epidemic Intelligence Service Officer for the Centers for Disease Control and Prevention, responding to infectious disease outbreaks in human health, including multi-drug-resistant tuberculosis, measles virus, and Zika virus. With experience at organizations including the Smithsonian National Zoo, the Food and Agriculture Organization of the United Nations, and the United States Department of Agriculture, Dr. Hall is passionate about working on complex ecosystem health challenges on a global scale and engaging stakeholders and partners at all levels. Now, as Executive Director of the Raptor Center, she oversees a team of professionals who treat over 1,000 injured raptors a year and who care for 28 ambassador birds. In addition to excellence in care for individual birds, she also leads innovative ecosystem health research at the University of Minnesota to help secure the future of the environment that humans and animals share. This involves working on critical health challenges like SARS-CoV-2, lead toxicity, and avian influenza, which is the topic of this episode. Welcome, Dr. Hall, and could you, for our listeners, kind of give us a little bit of your origin story?
Oh, absolutely. Hello, Gail. Thank you so much for having me. I am currently, as you mentioned, the Executive Director of the Raptor Center, but I'm also a veterinary epidemiologist. So I got my start in Cincinnati, Ohio at the Cincinnati Zoo using ambassador animals to educate and inspire the public. The hissing cockroach was my specialty then. And then throughout my career, have spent time working with free-ranging wildlife in places like East Africa. When I was spending a lot of time doing conservation work there, I realized that the world's a very interconnected place, and you can't separate human health from wildlife health, from environmental health. Everything's so connected. So I took a little bit of a detour on my path and realized that I could help wildlife by helping people and helping build up communities of people that are living around wildlife. So I went down the public health train a little bit and worked on things like food safety and food security. How do we raise healthier animals so you can help attack things like nutrition in the world? How do you control animal diseases, including the risk from diseases jumping from wildlife to people, which is timely these days. And then also went into the CDC to work as a veterinary epidemiologist there, responding to both animal as well as human infectious disease outbreaks. Had enough with the people world. So went back to the animal world at the Smithsonian National Zoo most recently as their veterinary epidemiologist, helping both captive and free-ranging wildlife before coming here to the University of Minnesota and the Raptor Center.
So can you explain just a little bit of what an epidemiologist is? I mean, what does that word mean? It's a great word, by the way. But yeah, what does it mean?
Absolutely. So CDC calls them disease detectives.
Ooh, I like that better.
Right?
Sorry to interrupt. I love that better.
They're epidemiologists because it goes back to the world of Jon Snow and not the Game of Thrones character, but the epidemiologist way back in London when he was hunting down a cholera outbreak and trying to figure out what was causing disease. And he'd go house to house and interview and question people and use all of his senses and what he could describe of what was happening in the health of the community to figure out that it was one certain water pump that was causing the cholera outbreak. So since then, epidemiologists have been on the front lines of public health as well as animal health, where we look for abnormal health events or health trends and try to get in there and figure out what's the cause. And also, very importantly, how do you mitigate or reduce the risk that others get sick?
Well, that is a beautiful segue into what we're going to be talking about this episode, and that is HPAI, or highly pathogenic avian influenza. Comes by lots of names. Bird flu is one of them. I've also heard with this particular outbreak, H5N1. But before we get to what that all means, could you kind of describe or talk to us about what HPAI is?
Absolutely. So if I put on my epidemiology hat, I can say that influenza viruses are a fascinating group of viruses. They've existed for a very long time, and they can wear all sorts of different hats. Highly pathogenic avian influenza falls in that influenza A category. And this is a type of influenza that can infect people, they can infect animals, it can have an origin from people, or it can have an origin from animals. And that's when we give it an animal name like avian influenza or bird flu. Similarly, we've heard about swine flu, right? And that's just an influenza A that originated in swine. And oftentimes these viruses can jump between species. So, for example, it could go from a bird to a person. In some of the swine stuff, it can go from a person back to a pig. So just a really interesting virus that has adapted well to different conditions. Now, avian influenza in particular, it's an influenza A virus. It originated from a bird. We know that there is a lot of avian influenza in the world because it has a reservoir species of waterfowl. So waterfowl, shorebirds, seabirds can carry this virus asymptomatically. And as they migrate the world, they're able to take the virus with them all over the world. They come together at migratory stopovers. They share their influenza viruses. Influenza viruses can mutate, reassort, shift, drift, do all sorts of things. So they look a little bit different when these birds then fly off and take in those influenza strains with them.
Ah, okay. So I know many people are, everybody is pretty familiar with SARS-CoV-2 or COVID-19 and how we've had some mutations and things like that kind of recirculate. And is that kind of what we're talking about? Is that there's mutations happening and changes with the virus itself so it can adapt to different circumstances or be more infectious or less infectious or whatever?
Yeah, you can definitely have different mutations that allows it to transfer differently or cause different amounts of illness. And influenza strains in particular have different H and N types. So you asked earlier about H5N1.
Yes, please. What is that?
Yeah, and it's again nerdy fun. It's the surface proteins on that molecule. And you've got a whole bunch of different H types, a whole bunch of different N types, and that's how you name it. So this is the hemagglutinin protein 5, so H5, and the neuraminidase protein 1, so H5N1.
And that combination is what's causing a lot of the challenges that we are seeing currently, right? Because like you said, the low pathogenic avian influenza gets passed all the time, and that's a different combinations of H's and N's, correct, of those proteins, but not causing any like disease, at least not in the waterfowl. But then this one's changed to H5N1. Very interesting. I do need to nerd out on this a little bit. How we know that HPAI is now in North America, has been for a little bit of time, started up on the East Coast. Well, yeah, East Coast. And you can correct me anywhere where I'm misstating. But where did this originate? It didn't originate here, did it?
Absolutely. So we talked about the fact that this virus can be transferred all over the world because you have migratory birds, and there's a flightway that comes from Europe area into North America. Actually, I think it lands up in Canada. So this virus, the best we can tell, this strain H5N1, again, it's a highly pathogenic avian influenza versus the low path we were talking about. And it gets classified as high path when it has the ability to cause severe illness in chickens when they're infected in a laboratory setting. And these high path strains tend to be H5 or H7 strains. So this is one that can cause a lot of severe illness in poultry, so it gets global attention. But we saw this virus being transmitted in Europe and in the UK previously, before we saw it here. And then most likely a bird came and they brought it across the flyway, and we saw it in Canada. And then we saw it come down the East Coast, hit kind of the Florida area. And now we're watching it go back up the central and the Mississippi and the eastern flyways.
Yeah, it's like, wow, I've been watching the geese fly over. We're recording this in early April and watching the geese fly over going, oh, please don't bring it. Please don't be you. Please don't be you. But it is here. And we know that it is here in Minnesota and all the states around us right now. So, okay. So we know that this is a concern for a lot of poultry operations. Around the country, around the world, right? And chicken and turkeys and other poultry are incredibly important for the agriculture business, but also for a lot of us. A lot of us consume different types of chickens, and some of us even have chickens in our backyard. So this obviously is a big concern for like the USDA, Department of Agriculture, and the federal government. But what about, is there lots of concern at a governmental level about the wild birds, or only where they can maybe share the virus with the poultry, which is a concern, a huge concern, but where is that level of concern?
Yeah, so you're absolutely right that this is a globally reportable disease because of, again, the definition of high path, extreme mortality in chickens if it gets into a chicken operation. So can cause huge amounts of impacts to our agriculture colleagues. Wild birds do get paid attention to quite a bit because we also see them as an indicator for what's circulating in the environment. Because if we can know what's coming or what's happening in the wild, you can better mitigate or do protective measures too for captive animals. So definitely the most attention right now is being done on these poultry facilities because they want to make sure that we keep these facilities as safe as possible. Some of these facilities have millions and millions of birds. And unfortunately, if it does get in their facilities, then the response is to depopulate the whole facility, which can just be catastrophic to the owners and the people that work at these facilities, and to the birds as well. The wildlife side of things, typically, we don't see this much transmission and sickness in wild birds during these outbreaks. Oftentimes, you're just seeing different poultry facilities. So like in 2015 in Minnesota, really, we tested all the birds here at the Raptor Center. They were testing at the Wildlife Rehab Center. I think they found 2 chickadees positive the whole time, right?
Right. I remember that.
Yep. And just the first few days of testing at the Raptor Center, we've already got a couple handfuls of birds that have tested positive. So this is definitely a different kind of high path outbreak than we've seen in the recent past with all the wildlife getting involved. Okay.
So when you say that the Raptor Center has had some birds that have tested positive, the Wildlife Clinic of Minnesota also, I know, has had some positive cases. So what does this look like? And I know that that's a big can of worms I just opened because my guess is the answer is it depends, but I'll let you say that.
Oh, it looks like a really terrible spring is what it looks like. And I think all the rehabbers in the United States and in Canada, and we still have colleagues over in Europe that are struggling as well. It gets very, very complicated quickly when we have this much disease in wildlife. And we have a lot of different flavors of what the disease looks like. So any bird is susceptible. It's avian influenza. So any bird in theory could be susceptible to this virus. Now, how they show the signs or not show the signs, and if they're able to spread it to others or not, is what's highly variable. So we think of the ducks, the waterfowl, the shorebirds, the seabirds as ones that are more prone to not showing signs, but being able to spread it and infect others. Now, this outbreak, we've definitely have reports of, deceased geese and neurologic ducks and things like that. So it's not a hard and fast rule. They're just more likely to not show signs. Where we know birds like raptors have a 90 to 100% mortality. So these birds, and especially the ones that we've seen recently at the Raptor Center, come in severely neurologic, seizing, unable to stand. And we're also, unfortunately, seeing whole nests fail and having the deceased birds from these nests test positive as well.
Wow. Like the young are in the nest, deceased.
Yeah. We've had great horned owls where we've found deceased adults as well as babies.
Wow. Oh, yeah, it's heartbreaking. Absolutely heartbreaking. Okay, so there have been some cases of, death at the nest and that kind of thing, and then we're seeing severe neurologic signs. Is there a good way to treat this, or pretty much not? And the way to treat it is the best gift, which is euthanasia in this case.
Absolutely. There's a couple perspectives here. So in rehab, we worry about the individual, but especially with diseases like this, we have to think about the population and how do we make sure we're taking care of all the birds in our care and birds in our area as well. For the individual, with raptors, I will say all the patients that we've had that have been positive have been so severely suffering and neurologic when they come in. The absolute most humane thing we can do for these birds is humane euthanasia for these guys. They're so far gone. Could you treat or should you treat? I think are the two different questions.
Yeah, those are the questions. Mm-hmm.
Yep. Depending on the species, and we just don't know so much about so many species. I suppose there could be treatment options. The concern would be you're dealing with a bird that everything that's coming out of that bird has infectious particles in it, right? The respiratory, the oral secretions, its feces, everything has virus particles. And avian influenza is remarkable. Again, Epi hat on, it's a very cool virus because it is able to spread itself remarkably well on fomites. So items that might carry infectious virus. So shoes and clothes and dirt and
feathers.
Feathers and, rodents that run through the area that then go to a different area. I can't imagine a situation where you could put enough biosecurity around a positive bird to really feel comfortable that you're containing that virus there and not creating a risk to others.
Oh my goodness. So I really like the idea because you are absolutely right. In rehabilitation, we are treating the individual. When it comes to endangered species, then of course that individual really matters for that population. But we often need to think about, and we've had to think about with like chronic wasting disease in deer and a few other diseases, that we can't just think about the individual. We have to think about the population. And this is one of those cases, definitely. In reality, this is a natural phenomena, right? I think it cycles every, to get a high path avian influenza, like every, 7-8 years, something like that. So why should we care?
This virus has just an incredible global impact that we really need to pay attention to. Focusing on agriculture for a moment, because I think that's where it's the most devastating. To control this virus involves trying to lock down facilities, and if it gets into facilities, going in, depopulating, composting those birds where they depopulate them in the barns, and leaving those barns empty for a good amount of time. Before that producer can bring more birds in. So you're destroying a livelihood when it gets into different buildings. You're interrupting the food system. We're already seeing eggs, the price of eggs going up right now, attributed to avian influenza. And different areas where there's been positives, there's now global trade restrictions on their ability to move chicken products. So it's being reported on a global level. So it can just be absolutely heartbreaking and devastating to the agriculture industry. It's also a zoonotic disease. It's very rare that it can go, very, very rare. It can go from a bird to a person, but the risk is not zero. So we always have to pay attention when there's human risk as well. And then finally, when we're talking about wildlife rehabbers and people with captive wildlife, different wildlife species, it kills at the same rate as chickens, right? So here at the Raptor Center, we have ambassador birds who are permanently with us that are near and dear to our hearts too. We also see about 1,000 patients a year. We don't want an outbreak in our hospital that wipes out our patients. And we certainly don't want it to get to our ambassador birds. And we certainly don't want to take something that's in our hospital back to our homes where we might have backyard chickens that can impact. So it's so infectious. It's so devastating to certain species. That we really need that one health approach where the wildlife folks are working with, the domestic wild or animal people, and they're working with the human health people to mitigate this risk.
Right. Yeah. Thank you. I mean, I think that that's something to just talk about, that it is that one health approach. This is where really the environment, the animals, and the humans are all intersecting. And we as wildlife rehabilitators have an opportunity to really help protect All of those, we're a piece of the puzzle. We're not the whole puzzle, but we're a piece. And we need to play our part. So thank you for that. So as far as, okay, we're wildlife rehabilitators. Now we've got a conundrum. If I just take mammals in for this particular disease, I'm okay. Rabbit hemorrhagic, well, that's something else. That's one of the next episodes, podcast episodes on that disease. But so let's say I'm a rehabilitator that takes in everything, and I am one of those rehabilitators. I'm an equal opportunity rehabilitator. Now, I'm a home-based facility, but there's certainly a lot larger facilities like the Raptor Center and the Wildlife Clinic that takes thousands of animals in every year, and then medium-sized facilities that are hundreds of animals every year. So how do I figure out what my response is going to be? I mean, we usually call it biosecurity, but how do I figure out my response to this?
Yeah, so everything is a risk assessment, and that's looking at what you have available, what your facility can do, be it a place like the Raptor Center here in the University of Minnesota, or be it your home or your garage or a shed out back, looking at what is your ability to do different biosecurity, different protocols, to do quarantines, to do testing. What is the risk that you might be bringing in, and what is the risk that it can get back out? With highly pathogenic avian influenza, unfortunately, that risk is astronomical right now because we know it's out there. We're finding it. Wildlife Rehab Center found it. We found it. We know that there's state and local federal partners all over the country in the United States finding it in wild birds. So starting with acknowledgement of what is the risk and what's the consequences of that risk. And with highly pathogenic avian influenza, they're pretty gosh darn severe.
Mm-hmm.
Then it's okay. So if I bring a bird in, and say it's positive, because there's a real risk you might bring a positive bird in.
Mm-hmm.
Can you do the protocols you need? Do you have the equipment? Do you have the personal protective equipment to be able to safely maintain that virus? And then what other animals do you have around that might be susceptible to that virus as well, right? Because it's not even just that one individual, it's what other animals are you rehabbing right there? And what capacity does your facility have to manage all this? Right. So that's my 5-second spiel on every facility is going to be a little different, but it's looking all about risk and what you can do.
Okay. And as I mentioned earlier, we'll have resources in the show notes and also on our webpage with that to give you a chance. We have a couple webinars I'll put up, but also some workbooks and things like that you can kind of go through and kind of figure this out as you go. So as far as the Raptor Center, when the Raptor Center decided, okay, we will not, well, and that's just strong language, right? Because, we're going to try really hard not to let this virus in our building. Was that the level? I mean, when you looked at the Raptor Center, did you say that this is the risk? What was the risk benefit analysis for the Raptor Center?
Yeah, that I had almost zero. I would like to say I have zero, but I'm an epi, so I never say zero, but almost zero acceptance of any risk of stuff getting into our building. Mm-hmm. So because the consequences are too severe. Mm-hmm. So when we're looking at our center and saying, okay, because there's a real moment right now where you say, you just stop. Because protection against highly pathogenic avian influenza, you need to do all the way to perfection or probably not at all at this moment. Because the in-between gets scary. So we said, okay, so one way to reduce risk is we stop accepting birds, right? We're not going to bring in a bird from the outside with AI if we're not bringing in birds. The other side of that was, okay, can we engineer our way out of this with enough biosecurity and protocols and testing that we feel like we can still accept birds with minimizing the risk to our current hospital patients and our education birds as much as possible to a level we're comfortable with. So we decided that we were going to stand up a separate facility during this outbreak so that we could bring birds in. They go into a separate building that's not even connected. and that it has its own air supply and its own water source and drains and such. And that we're going to have personnel trained in extensive biosecurity. So they're wearing Tyvek suits and boots and N95 respirators. Because remember, even though it's rare, this is zoonotic, meaning it could go to a person, and goggles and gloves. And we had the health department come out and watch us put it on and take it off, because that's just as important as wearing it, is how you safely put it on and take it off. And we stood up this building in a matter of days and have taped lines on the floors on when we step where and when we disinfect and when we clean hands, and how the birds come into the facility. They get tested, they get evaluated. If they're not suspect birds and they test negative for the virus, then they can go into different quarantine groups. Because we know that if a bird was just exposed to the virus and then they were brought in for something else, they might not test positive right away. So we needed to be able to not just safely triage them and test them, but also to be able to hold them safely for a couple of days. And our days are 5 to 7, so that we could test them a second time before we deem that bird safe to come into our hospital, or as safe as we could.
What kind of tests? What are you testing? Where does it go? Who do you work with? What does that look like?
Yeah, so testing is a popular question right now, because in theory, the PCR testing, which is looking for virus off of swabs, where you swab inside the mouth of the bird and then in their cloacal area, has to be done by labs with the authority to do it. Fortunately, we sit just across the street from the veterinary diagnostic lab, which is also our state lab. So they have the capacity to do it, but it also does come at a cost per each sample. But what this does is it's looking for a virus that bird is shedding right then. And it's also pretty gosh darn sensitive, meaning that it's going to pick up positives. Now, the other testing that's out there is called antigen testing. And you might see some of it requires your Board of Animal Health to approve. Others, gosh, I think you can even get it over the counter these days. That's looking for influenza A viruses. Now, the huge caution with this test is it's much less sensitive, meaning you could have positives that don't have enough virus in them. We've heard about this with COVID too, to test positive yet.
Right.
So if you're using that test, you have a very strong chance you're going to miss positives. So we've been really
false sense of security then.
Right.
Basically, right?
Yeah. Yep. You're using a test that, isn't going to give you all the information you need. And then those results could be catastrophic. So when we're dealing with a disease that has such strong impacts, if you're wrong, you really need a high level of certainty if you're using things like testing. And right now, the only thing available with that level of certainty is the PCR testing.
Okay. Can I just, if I can't do the testing, because I'm a small operation or whatever the reason, can I quarantine for a certain amount of time? Or is that dependent on species? Is that dependent on my area? That's a lot of the answers to my questions, isn't it? It depends. It depends, Gail. It depends.
Yep. Yeah, because a songbird's going to be different from a duck, is going to be different from a bald eagle, is going to be different from a crow, right? Or a blue jay with our corvid species. So that's a really complicated question. One thing I always like to say with quarantines, though, is that if you're doing quarantining, you either need to be able to have that one individual, be completely separate with biosecurity around it and not in the same airflow or airspace as others, with its own equipment that you're using to tend to it. And then you can quarantine that one individual. Or you have to do it in groups. And what that means is, as you're adding animals to a group, the quarantine period doesn't start till you stop adding animals. And then you need to go through a quarantine period, right? So if you have a facility, and a lot of people are trying really hard to do really innovative ways to try to address this. But I'm hearing a lot of folks that are like, it's fine, I'll just keep adding all these birds. And after 7 days, I'll take a bird out. And just know if you keep adding birds to a quarantine group, you're adding new risk and exposures to those birds. So for any sort of quarantine to work, you really got to think hard about, can you manage groups as discrete groups that have biosecurity around them? And I'm just going to be honest, it takes a lot of work and a lot of resources and space.
Right. I'm even thinking, because we're in Minnesota, we haven't hit duckling season yet. And duckling season we do a lot of ducklings. Minnesota is the land of 15,000 lakes, right? We do a lot of different kinds of ducks. And so that scenario that you just described, I can totally see that that's where it comes into play with all the birds, but in particular with something like ducklings. And then I did have a side question, that I actually looked up the answer to. So I do know the answer to this, but someone was asking me about incubating eggs, because a lot of people get duck eggs too, because the hen dies for whatever reason. And they're like, well, maybe we can hatch eggs. So I learned that there's vertical transmission right from the hen through the eggshell. And that makes sense, right? Because the eggshell is porous for that poor little duckling on the inside. So anyway, so I wanted to get that out there too, because certainly people have been asking me questions about that. So I don't know if you have anything to add with that, but all along, all age classes, it can affect.
Again, if I take off my, Raptor Center and rehab hat and put on my epi hat, go, again, it's a fascinating virus that does its job very, very well for what a virus does, right? Mm-hmm. Now, putting back on the rehabber and Raptor Center director hat, it makes me highly concerning because we do know that young and babies can be affected. And that was kind of a question when we were just starting to see cases of this. And we know through the science about what can be transmitted with eggs. We've also seen it with baby great horns falling out of nests because of high path signs, that even the young need to be considered a high risk during these times of just incredible transmission in the community.
Mm-hmm. The one thing we didn't ask, or I didn't ask earlier, so we talked about how waterfowl kind of pass it back and forth. And there must be some sort of, with the poultry industry, some person or tires or something or a duck flies over and poops, who knows how it gets into the poultry industry, right? Or into a barn. But how do raptors usually contract this?
Yeah, so avian influenza can survive in all sorts of temperatures and environments. It actually can survive quite a long time in cool and wet environments, which at the start of April, Minnesota, we've got plenty of that outside right now. Mm-hmm. It starts to die quicker once it gets really hot and sunny out. But it can survive in that environment quite well. It also survives in any animal that dies with it. So we think of some of the poster children of getting infected with it, like our vultures and our bald eagles and some of our corvids that might be going and feasting on animals who have died. So they could get it directly from a dead duck or, a different animal that's infected with it that they've caught and killed or that they're scavenging on. It can also be contamination within the environment that they could catch it from as well. Mm-hmm. So it does a very hardy job of surviving in the environment and surviving on infected animals.
So is this virus going to be this H5N1 subtype? Is this going to be with us forever?
Yeah, so the good news is these outbreaks don't last forever. Now, quite how long, my crystal ball is still broken from COVID, so I can't quite tell you that. I keep trying to reboot it. Typically, what we see is that these peter out in the summer months. So once it gets dry and hot outside, we see the numbers go way down. And also once that migratory bird surge has quieted down as well, and ducks go off on nests and things like that. The one concern, though, with how much it's in wildlife is sometimes you see it come back with the next migration. Okay. So that'll be something that all of the hard work that everybody's doing right now to figure out protocols and biosecurity and what they do or don't do right now. These are all just such important lessons to be capturing. Because first, there's more out there than avian influenza that could be infectious, right? So biosecurity is great all around. And second, whether it comes back the next migratory season or whether it comes back in 5 years, which we know we're going to see an outbreak again in the future, you'll have your plans ready to stand up again. Okay, awesome. So that's definitely a plug. But I also think to try to, when we're wrapping this up, action items and positive, right? This is an opportunity. It's coming on the heels of something pretty gosh darn awful.
but it is an opportunity to look at your biosecurity and plan and know that the efforts that we make now is helping the population, is helping our farmers, is helping that whole intersection, that whole One Health thing. So it's definitely an opportunity for us to do that. So as a wrap up, are there, I don't know, 3 or 5 different things that you want people to go away with from listening to all this about HPAI or biosecurity?
Yeah, and I think you just hit on one of the most important ones, is that this is not just a wildlife thing. It's not just an agriculture thing. It's not just a human thing. It's a One Health thing. And the impacts of everybody is going to determine how our community does and how the disease transmissions happens in our area, how our populations of domestic and wildlife does throughout this. So if you're dealing with captive wildlife, you are playing a role in what is happening, and you are helping to decide how the whole population is going to be doing throughout this outbreak and the safety of the people who are working around these animals. Mm-hmm. So really acknowledging the roles and the incredible opportunity you have to play a part for the better during this really challenging time. Because I think the second thing I would say is that this is going to be really, really rough for rehab right now. And I think it's important to acknowledge that this is going to be really rough, and we're going to have to make decisions that would not be our first choice, right? Whether it's decisions about what you may or may not rehab this season, or how you're going to triage, or how, you might use things like euthanasia. It's not going to be normal times, and it's going to be hard, but everybody's here in it together. And I think that's important, and it's not going to last forever. So this is a short-term thing that we're doing to rise to the occasion of this severe illness that's happening in our avian species, and that we're going to get through it. And there's going to be another side about that. And I think the third thing is that we are fortunate. I worked a lot on SARS-CoV-2 when we were worried about it jumping to animals. And that virus had a lot of question marks. So the last thing is the fortunate thing about avian influenza is we know a lot about it. We know how it transmits. We don't know all the details about what it does in different species, but we know how it transmits. We know in theory how to stop it from transmitting. We do have the ability to test. We've got people at the local, state, and federal level who are engaged in the responses. So we have a huge arsenal of tools that we can pull out and we can use to make our plans at this time. So really leaning on, Gail's going to put a bunch of the resources into the notes here. Leaning on what we do know about this virus to protect ourselves puts us in a really good position.
Okay. Oh my goodness. What a wonderful way to end. I want to say thank you so much, because I know with the Raptor Center's response, and you have been involved in helping a lot of other centers and a lot of other meetings and everything like that on HPAI. So thank you so much for taking the time to help us all understand this disease a little bit more and what we can do and the opportunities it presents. The last thing I'm going to mention is one of the things that you have told me that has really been sticking with me is don't panic, but plan. So we're going to end it with that. But again, thank you so much, Dr. Hall. Really, really appreciate it. And again, there will be resources in the show notes, also in the web page. And if you have any questions or concerns, and it is going to be a rough rehab season, you feel free to reach out to me. And my email address is gailbuhl@umn.edu. So please feel free to reach out. Thank you for joining Dr. Hall and myself to talk about HPAI. Check out the show notes and resources on the Partners for Wildlife webpage. This disease affects everything with feathers. It will be a rough year for the birds and for all of the wildlife rehabilitation sector. Hang in there. This was another episode of Wildlife Rehabilitation from Rescue to Release. We're glad you joined us today. Wildlife Rehabilitation from Rescue to Release is a production of Partners for Wildlife, working hand in hand with wildlife rehabilitators and veterinarians to improve the welfare of orphaned, ill, and injured wildlife. Our executive producer is me, Gail Buhl. I'm the Partnership Coordinator for Partners for Wildlife at the University of Minnesota, College of Veterinary Medicine's Raptor Center. To learn more about the Raptor Center and Partners for Wildlife, visit Raptor at umn.edu. Our producer is Kurt Clockey. Are you interested in becoming a licensed wildlife rehabilitator? Visit the National Wildlife Rehabilitators Association website at nwrawildlife.org for resources to get started. And remember, if you do find an injured or orphaned animal, please contact a licensed wildlife rehabilitator in your area. And that's our show. Hope you'll join us next time.
No, you're not broken yet, and that's because you're a firebird. It takes one to know, live in the open, never forget it's so. Your fierce eyes shine bright just like sapphire. Firebird, please learn to let go. Because your cradle is my sepulchre. Why don't you come out and seize the day? Carpe diem. If you see them, won't you show them the way? Build yourself a nest in a branch of oak and heave out your last breath there. Freedom's but a hair's breadth away. Sometimes the hardest thing to swallow is that they can't even tell. This isn't just one song, no, the kestrel's coming. Another 500 years. Just keep it coming. Just keep it coming. Keep infusing frankincense. You fill your nest with cinnamon scents. I couldn't feel the force of your renewal. Firebird, yeah, you gotta leave your nest or you won't know. You're one of us, Firebird. Because we have met, it will be better. Yeah, we're birds of a feather, Firebird. It's not a case of learning to the letter, but breaking out of fetters. You've already learned. I need you to see. If you bend any brighter, you would be a significant risk to them. Don't make me insist again. Come on, Firebird, build a nest, not a nest, no. Firebird, yeah, you gotta leave. Burn the nest, forge a new beginning. I need you to believe you are a Firebird. Firebird, yeah, she helps me see infinite infinities. I need you to believe you are a Firebird. This is kinda cool, carnival-esque art is getting to be part of who she is. As it's getting kind of old, is it getting kind of easier? significant risk to them. Don't make me insist again. Come on, Firebird, build a nest, not a nest, no. Firebird, yeah, you gotta leave. From the nest forge a new beginning. I need you to believe you are a Firebird. Firebird, yeah, she helps me see infinite infinities. I need you to believe you are a Firebird. I need you to seize this chance to change your world. And if your days are numbered here, know there will be infinite others. Another full 500 years, and then another, and then another.